So in retinal disorders, what has become clear over the last 10 to 12 years, 10 to 15 perhaps, are the following facts or facets of the biochemistry that occurs in the cell. There's clearly evidence of inflammation, that low-grade inflammation that we've heard about yesterday and today as well. Oxidative stress, which is coupled with the inflammation, as we've learned. And in addition, there's dysregulation of the insulin signaling pathway. Let me give you another example and perhaps a slight sidebar as well. It turns out, if you look at patients, these are beautiful studies done by the NIH many years ago. If you look at the patients with macular degeneration, all comers, and then watch their progression over the next 5 to 10 years, those patients who ate the highest glycemic food and who were quote-unquote pre-diabetic, their disease developed more rapidly. I remember reading this when I was a fellow in St. Louis some years ago, and it struck me right away, geez, and it struck many people, I shouldn't say myself only, is that the importance of the insulin signaling pathway in these disorders. That's one. The second thing is if you look in the basic research literature, there's only 2 pathways so far in the published literature that I'm aware of, and colleagues are aware of, that improve the overall survival and functioning of an organism. The insulin signaling pathway, right, or modulating it, and the mTOR pathway. And I'm not going to talk about that. We published a series of papers over the last year and a half or so, a set of 3 papers really, culminating one earlier this year. The role of the mTOR pathway in autophagy, which we've heard of a little bit yesterday as well. But this is our work was on really understanding what are the biochemical steps that occur that lead to the activation or the inhibition of that particular pathway. Those 2 pathways, by the way, are the only 2 that are known to promote longevity, improving the overall function of an organism, right? So the insulin signaling pathway and the mTOR pathway. We also have heard about mitochondrial dysfunction. Surprisingly, it also participates in chronic diseases of the retina, a catabolic state. What do I mean by that? What I mean is that the system is over-revved up from its baseline state, so it's out of disequilibrium, and I'm going to come back to that in a little bit. And then finally, of course, when all of these various pathogenetic events occur, then they conspire to lead to dysfunction and death of photoreceptor cells and retinal tissue. And that's actually when patients come to see us, right? They come to see somebody like myself as a retina specialist or an ophthalmologist when there's something affecting vision. And what I'd point out to you is many times if it's caught early enough, and you can reverse that. Some of you may remember from freshman chemistry in college, right? This concept of Le Chatelier's principle, microscopic reversibility of chemical reactions. So it turns out it's true at the organism level as well. So one of the challenges in all of medicine, right? So physicians only do 2 things, right? We measure structure and we measure function, right? Is if we can get to structural or functional changes early enough, there's the potential to reverse them. And is that possible? Yes, we see from the brilliant work of many clinicians outside of vision biology, for example, the reversal of coronary artery disease, Caldwell Esselstyn and others, Dean Ornish have demonstrated that. We've heard about Dale Bredesen, his work. We've also seen in other areas of medicine as well, where there is the potential, if caught early enough, to flat out reverse a disease, which is, of course, in some sense, the holy grail of all of medicine, is to prevent the development, and if it's early enough, to turn the ship around and take it in the other direction. And I believe it's not just simply pie-in-the-sky science, basic or clinical science. There's rising, compelling evidence in the literature in my own field as well in other areas of medicine. And I think it's a particular, I believe we're sitting on a precipice in medicine and science of making some fundamental discoveries or fundamental paradigm shifts in the way we treat people. I think many of you already embrace that, and that's part of the reason why you're here. Now, if you look at chronic diseases, if you see, I just changed the title of the slide and the last bullet point. Instead of saying photoreceptor cells, I wrote dysfunction and death of relevant tissues and cells. And that turns out to be true, right? The idea is to modulate these. And as I said, I'll be talking about a simple model for hopefully that you may remember at the end of this talk or in the middle of this talk. Now, what is the nature of chronic diseases? They're slow in onset. They appear to be multifactorial, may have genetic components, multiple genetic components really, multiple clinical presentations, and appear to be reversible in early stages. And nearly all current medical therapies target symptoms and not root cause. Now, that's for all of you, especially in this audience, I think that's something you have or have embraced or are about to embrace, as it were. But I would tell you, like when I've given the parts of the same talk, I was actually at a meeting, a vision biology meeting a couple weeks ago, as giving a keynote talk, and when I pointed this out, it was very interesting to get the response. I've given this parts of this talk, as I said before, in retina meetings, and very interesting to see how my retina colleagues and vision biology colleagues, they said, oh, that's right, we're treating the symptoms, we're actually treating the underlying cause. And so, again, we came at this from understanding the biochemistry was happening at the cellular level, and then translated that back into potential therapeutics for patients with retinal diseases. Now, here is a list of chronic diseases. Many of you are already familiar with these or are treating patients with these disorders. I just point out one thing, and this is a remarkable, I was looking in the basic literature some years ago. It was actually in part related to this, prospectus paper that we're working on right now. 70% of cancers are nutritionally controllable. That's a pretty remarkable number, and I'm sure many of you are familiar with these nutritional ketosis as a way to control cancer cell proliferation. But even beyond that, in the older literature, there's some very nice work done by many people, and when I share this with colleagues, they go, geez, how come people don't know about this? And I said, well, you know, in the US we have big pharma, by the way, the only country on the planet that allows the pharmaceutical industry to advertise. It was us in New Zealand, by the way, 3 years ago, and now it's just us alone. And I said, you have big pharma, but who hears of big broccoli, right? I mean, nobody, they just don't have the budget, right?